we go. Excellent. Right. So welcome again, ladies. My next challenge is to be able to share the screen with you. Okay. So I'm going to share. Okay, right. Just a minute. I see what's there. Need to do. Open this one. Okay, that's better. I'm just going to share my screen with you, ladies, if you just bear with me. So we're looking at learning outcome number 2. Okay, let's go back to you guys. Okay, Sabrina. Right, okay, this should work now. Please give me a thumbs up if I'm sharing. Thumbs up, perfect. Okay, right, lovely. Okay, so we can start now, ladies. We're going to be looking at learning outcome number 2 and 3 today. And this is a learning outcome number 2 is about our social responsibility. So our responsibility to the greater community. Okay, so our responsibility should be transparent. So what we do should be, I'm just going to close this, guys, that's better. Should be transparent. We shouldn't be hiding things from our clients and the greater society. We should be accountable for the things that we are going to do. We should bear in mind human rights. It will reflect our ethical behavior, how we behave ethically, how we behave as a professional. And we also, with all this in mind, have to be compliant with the law and legislation at the time. Now, I know this keeps changing, ladies. The government says we're doing this, then we're not doing this, then we're doing it this way, then we're doing it that way. So you have to try and keep abreast of everything so you know that you're actually following the right things at the right time. So social responsibility, the practice of producing and supplying goods or services in a way that is not harmful to society or the environment. So that's the term social responsibility. The practice of producing or supplying goods or services in a way that is not harmful to society or the environment. Social responsibility, businesses operate in a way which is in the best interest of their staff, clients, and their community. Okay, ladies, sorry, I forgot to say when we were trying to start, can we go back to our muting? Sorry, ladies, I did forget to say. Yeah, so if you could go back onto mute. I was just trying to work it out. I couldn't hear you, so that's good. So I'll start again. So social responsible businesses operate in a way which is in the best of their staff, clients, and the greater community.
Sorry, I can't see the presentation.
Can everybody else see it?
No, not me as well.
Everybody else, apart from those two ladies?
No.
Nobody? Okay, let me stop and start again. Okay. Remember, ladies, if you can't see what I'm saying, give me the thumbs down. Yeah? Otherwise, I'll just carry on. Okie dokes, let's have a look. Are you seeing now?
Yes.
Thumbs up. Okay, so please, if you're not seeing anything, give me the thumbs down because sometimes when I share, it stops sharing for some reason and it just shows me. Okay, so just give me a thumbs down if it all goes perfect. Okay, right. So we were saying the business need to operate in the best interest of their staff, community, and society at large, and also our environment. There are benefits for the local and national communities, staff, and clients when a business practices social responsibility. The efforts and benefits of social responsibility are far-reaching, and everyone has a part to play in relations to COVID-19. Yeah, so everybody has a part to play. Social responsibility, responsible business demonstrates ethical behavior, accountability, transparency, respect to all stakeholders, consideration for social norms and behavior, respect for human rights, compliance with legislation and law, and promotion of sustainable working practices. So when we are looking at our responsibility, our social responsibility, as I said at the beginning of the PowerPoint, these are the things that we need to remember, to keep in mind. We need to be accountable. That means that if I had a salon and I put a register of who comes into my salon and who doesn't come in, and unfortunately we had an outbreak, and I only put it on a scrap of piece of paper at the end of the day, my therapist throw in the bin. Am I being accountable? No. Okay. I need to be transparent. So I need to say to my clients, not when my client turns up at the door, oh, you have to wait outside and come in when it's your appointment. Okay. I need to be transparent. I need to tell them beforehand, by the way, client, I need your appointment is at 1 o'clock. You're unable to enter the salon or nail bar until 1 o'clock. It's quite cold out here now, isn't it? Yeah.
Yes.
So we are unable to enter the salon till 1 o'clock. So please come in time for your appointment. Okay, because we no longer have a waiting room. Not just think, oh, well, I'll just let her come because you'll come early, but you can wait outside in the cold. Okay, so we need to take and demonstrate all these things that are here. What about promotion of sustainable working practices? I wonder what that is trying to mean. So remember, it was our social responsibility for our wider community, but also the environment. Okay, we've been hearing that word environment for a couple of years now, haven't we? Our carbon footprint. Okay, we then, as community of the world, we need to have working practices that are sustainable. Sustainable means working practices that will help our environment. Okay, so for example, we will have things like cotton wool discs instead of sponges. Yeah, so I don't have to be using lots and lots of sponges, using my UV cabinet on 24/7, using up electricity, emissions into the air. Yes, instead I would be able to have disposable and put them into the bin. So for examples like that. Okay, so let's look at social responsibility in our role. The beauty therapist or the nail technician needs to be socially responsible, though adhering to the advice provided by the government guidelines, which affect both working and personal life. For example, it's important to maintain the specified social distance to prevent the spread of COVID-19 and to comply with the legislation around workplace operations. So adhere to government guidelines of the country that you're in, and adhere to workplace policies in relation to COVID. So a few months back now, because we've been in this a few months ago, we started out with the 2 feet, didn't we, distance? Then halfway through, I think it went to 1.5, wherever possible. I think it changed its guidelines to wherever possible you could do this. So we need to, as I said before, you need to keep abreast. It's gone back to the 2 feet distance. okay? And you need to carry this out with both in your personal life, but especially in your salons or your nail bars, okay? So we need to watch Boris's speeches, or we need to read the newspaper, or we need to go on social media so we know what the changes are. Remember earlier on in a few months ago, we were allowed to open, yes, in our industry, but we had to be wearing the masks and the visors and the gloves, yes? So that wasn't happening before. So things change. Then we couldn't work on the face. We now can work on the face. We need to be abreast of things that are happening and stick to the rules so that we prevent the spread of this happening. Health and safety and well-being of staff and clients. In order to maintain the health and well-being of staff and clients, it's important to follow the current government guidelines for the country that we're in. We need to establish protocols and procedures in relation to COVID for the beauty and nail bar. Okay, so we need to, again, going back to what I just said, we need to keep abreast and find out what is happening and what we need to do to make sure that we are following the government guidelines. So this on the far side of this PowerPoint, these were some of the things just to remind ourselves, because we've had so many. Stay at home when you're sick. Okay, so when you're not feeling well, we stay at home. Avoid close contact with people who are sick. This includes your household. Okay, wash your hands for at least 20 seconds. Cover your cough or sneeze with a tissue. So when you're coughing, sneezing, common sense really, isn't it? Cover it with a tissue and then you bin it. Avoid touching eyes, nose and mouth with unwashed hands. Now you'd be surprised, that one, how often people do it. Yes, so you might be sitting there nicely at home and look, I played touch with my hair and I'd sit like this to listen. And I'd sit like this and I'd do that. Yeah, we tend to do it without even noticing. Okay, so we need to be aware of this. Clean and disinfect frequently touched objects and surfaces. So clean with a cleaning product. Disinfect means that we're going to use a product that will kill pathogens. Yes, microorganisms. Okay, so clean, just us cleaning away. But when we disinfect, this will kill microorganisms. And these are areas that are high touch. Door handles. Yes, in our salon, everybody has to go in through that door handle. Okay, they will come up to the reception desk. Telephones. Okay, so things that we just don't even think about. The taps on the sink. Lots of people will use taps, yes? Or your therapist, clients washing their hands, especially in the nail bar. You wash your hands during some of the nail extension treatments. And that's quite a few people. Yeah, so we've got to bear those things in mind. And the last one they've got at the bottom is avoid crowded places. So taking this a little bit further, and it will answer one of your questions for your homework. We need to, as therapists and nail technicians, bear in mind and try and put adaptations into place for our normal services and our normal treatments that we do, put them into place where we can use or keep health and well-being for our staff and clients. Now, one of the things, the crowded places, obviously, hopefully we had a nice crowded nail bar or salon because we'll be making lots of money. But really, it wouldn't be in the treatment room you'd have the crowd, would you? You'd have it in the reception area. Yes, so hence, because clients would be sitting and waiting, booking appointments, walking past, coming in, booking appointments. So hence, one of the adaptations generally is to close our reception area. So all appointments would now have to be made via the computer, via email, or via the telephone. So that's classed as remotely. So we're cutting down the contact. This also can be done with your consultations, because when your client usually comes in, you would have a face-to-face consultation, wouldn't you? That's whether it be a nail bar or a beauty salon. These now can be done via the phone. Not so much email, because I'd want to have a feedback from my clients, yes, when I'm asking her the question. So I think the phone would be a nice way. When she's on the phone, you could be asking your consultation questions to her. So when she actually does come in for the treatment, that has cut down your contact time, hasn't it? So if you were going to do your consultation first, then you was going to do your treatment, and then you were going to give her aftercare. Aftercare now could be in the form of a leaflet or a paper, yes? So you could verbally tell her this aftercare in your consultation before the treatment, and you could then remind her by giving her a leaflet of things that would cause contractions, things that would make a condition worse, or things that she shouldn't do. So do you understand where we're going, ladies? Nice thumbs up if you do understand. Yes, we need to keep in mind all our staff and our clients by thumbs up, everybody there? Yeah, brilliant. Good. In this time, we need to bear these things and put them into place. And that answers that question that I was going to answer for the ladies. Question number, I think it was 52 she was asking. I've just answered it there. How to adapt things. So if I was doing, let's say I was doing a level 2 facial, how would I adapt my treatment? So I've adapted my consultation. I've spoken to you about the consultation. It could be remote. Aftercare could be remote. I've adapted it by wearing my PPE, my mask, my gloves. Yes, we didn't use these all the time. Okay, so that's another adaptation. How else can I adapt my facial treatment? My client can wear her mask up to the point where she needs to take it off. Okay, so that is adapting. Before, she wouldn't even wear a mask, would she? Okay, me wearing my gloves, I can't get used to it, but I've had to. Wearing my gloves through a treatment, I'm used to hands-on, yeah, touching skin to skin. That's just me as a therapist. But now I've had to adapt my treatment by wearing my PPE, by wearing my gloves. Okay, so I've answered a little homework question from there. So that is learning outcome number 2, ladies. Are we all happy with learning outcome number 2? Our social responsibility to the wider community and the environment. Yes? Thumbs up? Perfect. Good. Okay. Right. I am now. So I'm now going to change the PowerPoint. So I'm stopping the share. So if you don't get my PowerPoint come up, please give me the thumbs down. Okay. Right. Lovely. Let's go into. Right. We're going to be looking at learning outcome number 3, which is what I'm going to attempt to share with you. Okay.
Hello, ma'am.
Hello.
Hi.
Hi.
Good afternoon.
Good afternoon. Thank you for joining us.
Thank you, you too. But my network is being
Not good.
bad.
Yes. Okay. Are you not seeing anything at the
So
moment?
bad I
my
can't
darling?
hear properly because of my net.
Okay, sweetie. Okay. I'm going to put up, I'm going to talk louder, and I'm going to put up the PowerPoint. So everything that I'm saying will be on that PowerPoint anyway. And it, yes, and it will be recorded. But thank you for letting me know. Thank you. Right, ladies, I'm trying now to put up my next PowerPoint for you, which is number 3. Let's go in here. 3. Okie dokes. Right. You are sharing screen, but you guys are not seeing anything, are you? I can see that.
Okay.
Yeah. Coming. Right. Right, ladies, I have to try again. Don't like it. So your network is not the only one that's playing up, my darling. Okay, let's see what one is that. That was number 2, which is, I think you ladies have already seen. Let me just check. No, you've seen that one. Oh, screen has stopped. Okay. Sorry, bear with me, ladies. You know, we have these, and gentlemen, you know, we have these gremlins. So bear with me. Okay, right. I'm going to try again. I think that was it, guys. So I'm just going to find it again. Right. Are you seeing anything? Yes.
Yeah.
Perfect. See, perseverance. Okay, and then we'll get there. Okay. So let's look at learning outcome number 3, which is about breaking the chain of infection. Okay. So to stop the chain of infection, it is essential to break at least one link in the chain. So you can see we've got our circle on the PowerPoint. Yes, that's our chain of infection. We've got the infectious agent, the pathogen, the reservoir, the port of exit, the mode of transmission, the portal of entry, and the susceptible host. Okay, so that's our chain, and it just goes round in a circle. Yeah, it just keeps going. So how do we break the chain of infection, which is what we want to do? Because when we break the chain of infection, this will stop us spreading it on and on and on. So the standard infection control precautions are to do a risk assessment, regular hand washing, use of PPE, and safe management of linen. Okay, so these are things that we need to look at. So risk assessment. Now, just a quick question to you all. Does everybody know what a risk assessment is? Thumbs up or thumbs down? Everybody? Down, okay. Right, just checking. Let me just put thumbs up, thumbs down, please. Risk assessment. Okay, so we've not got lots. So let me go through a risk assessment. Thank you. A risk assessment is an assessment of something, of a risk that could cause harm to either yourself or your clients. Okay, so let's say, for example, me holding this phone in my hand is going to be a risk. Yes, so that's the risk. I need to assess how likely this is going to cause harm to you and me. Okay, so if this is our phone, I'll look at the phone and say, right, I have identified my risk. This is the risk. How likely is it going to cause you any harm? Not hardly anything, really, is it? Because you're in your lovely homes on your devices. So it's very unlikely to cause you any risk. Is it going to cause me a risk? Not really, because I could just put that down, can't I? Yes, so the risk assessment is identifying a risk. Let's go into a nail bar. So for example, their client was having their nails done. They've got up now to go and wash their hands through the treatment, and they've left the chair in the middle of the way. The chair is the risk. I need to assess how likely that chair is going to affect my client and everybody else around. Okay, from say 1 to 10. And that is the risk assessment. Okay, are we all a little bit clear on a risk assessment? Brilliant. Okay, so we all know our regular hand washing. We know the use of sanitizers, and we know the use of PPE. Now, again, to nail technicians, beauty therapists, PPE is something that we've done for years. Nothing new to us. Yes? So when it came on the TV and people saying PPE what? We knew. Yes, we always protect ourselves and we always protect our clients. Yes, it's something not new to us. We may use more PPE than we'd normally use, but we always had to use our aprons. Yes, we always used gloves in certain treatments, didn't we? So that's nothing new to us. But the use of PPE, for example, new to us is the face coverings, not all treatments, because there were some treatments, especially our nail bars, where we used our masks anyway. Yeah, so again, it's nothing new. The face coverings, gloves, aprons, etc. And safe management of linen, how we wash our towels, how we wash our blankets, what temperature they should be washed at, how do we make sure that there is no pathogens or microorganisms still on that material. Because remember, a few PowerPoints back, we found out how long these pathogens can live on certain materials, and that includes cloth and towels. Okay, we need to make sure, and again, this is way back on our health and safety, we need to make sure that we wash our towels on a nice hot wash. Yes, so that we actually kill all these microorganisms. So back to breaking that chain of infection. So these are the first things we need to do. Standard infection control procedures. We need to have respiratory hygiene and cough etiquette. There's an etiquette on how to cough, ladies and gentlemen. Okay, and we need to be aware of it. We don't just go around and cough. I think a lot of us would be looking strangely at people if they're just walking around and coughing. Okay, and there's a little paragraph that you need to cough into tissues. And if you don't have a tissue, you actually have to cough into your hand. Okay, now be aware that any microorganisms that you've expelled are actually on the clothes that you're wearing. Okay, safe management of equipment. So we need to make sure our equipment is safe by disinfecting and cleaning. Safe management of service environment. So our equipment obviously are our tools and things that we're using, our machines, etc. Our service environment is the whole salon nail bar area. Okay, safe management of blood and body fluids. So through some of our treatments, there will be some blood, not because we've harmed our client, but it may be part of the treatment, and body fluids, let's say, for example, waxing. Yes, when we wax, when you pull the hair out from the root and it's actually deep rooted, you will get blood. We like to see it as therapists, because that means we have taken the whole hair out. We haven't just broken it off. Yeah, so we're quite happy. But then that has to be disposed, a safe management. We can't just take that and throw that in the bin. Safe disposal of waste, including sharps. Okay, so some of our treatments will include a needle. Yes, or a lance. Microlancing in advanced facial, we're removing media from the skin. It is a lance, like a little needle. We don't just take that and throw that in the bin. Okay, we have a little sharp spots, and that has to be, needles have to go into the sharp spots and they have to be collected, okay, and disposed of. Occupational safety management and prevention of exposure, including sharps. So again, that is training that we need to train our staff to make sure we know how to remove the lance, yes, without causing stick injury. Heard of stick injury, ladies? Where you actually can use contaminated because you've not taken off the needle properly and you can stick yourself. Okay, so we need to make sure that will be in place. So that will prevent us from getting infections. Additional precautions now, especially now, will be social distance measures. Remember, I spoke about that, the crowds. Immunization and vaccination where possible. Okay, so that's the big thing at the moment. That vaccine's on its way. So immunization and vaccination where possible. Temperature checking. Okay, when your clients come into your salon or nail bar, when you come into the academy, we check your temperature. Yes, so temperature checking. Anyone entering the premises is required to undergo temperature checks in accordance with the local and national guidelines in the country. So again, this is a government instruction to us that we need to make sure that we do temperature checks. And I just want to pick up a few in these little pictures here. And obviously it's gone back to the hand washing. Yes, sanitization, sanitization, sanitization. It's there. Contact with sick people again. So if you're not well, please do not go to work. Please do not come into school. Please stay at home. I sound like Boris then, don't I? A prettier Boris. Okay. Remember the touching of the eyes, the nose with hand and unwashed hands. Wearing a mask. Now, I remember a few months back, you don't need a mask. Did you remember that, guys? You don't need to wear a mask. It's fine. It doesn't, no. Then it went that you had to wear it in the supermarkets, and then you had to wear it on the buses and trains. Yes. So you need to be aware where you need to wear your mask. Definitely when you're inside your salon, definitely when you're inside your nail bar, definitely when you are at college, at school, definitely in the shops. Not outside. You don't have to wear it outside. Okay, but we are protecting people. That shows my staff that if I put my face mask on, I'm thinking about them and I'm being aware I don't want to pass any infection on to my staff or my clients. Okay, clients will feel the same. They'll feel very happy. So avoid these crowded places. Now, this one is one that's not come up very often. That's why I wanted to talk about it. Do not share eating utensils and food. Now, I do realize that in some cultures, this is a very kind thing to do, to offer people, you may be having some lunch, and to offer some of your lunch, yes, or some of your food that you're eating. In these times, ladies, we do not share, especially eating utensils and food, okay? Not being offensive, but we are protecting. Okay, avoid traveling to affected areas unless necessary. So again, that's you bearing in mind, keeping on top of what areas are in our corridor. Remember, we've been given a safe corridor of countries that we don't have to self-isolate. You need to be aware of those. At the moment, you can't travel anywhere because we are in that second lockdown. So you're not traveling anywhere, unfortunately, but we're talking about abroad. You need to be aware who's and what's in our safe corridor. Thanks. Okay, so we need to have in place in our workplace standard infection control procedures. So these are things that are standard that we will do to help break that chain of infection. So all these things I've been talking about is helping us break this chain of infection. Remember that big circle at the beginning? Yes, we want to break it so that this infection doesn't keep growing round and round and round and round. Risk assessment. So we know what a risk assessment. Anytime you think of a risk assessment, remember my phone. Okay, that is the risk, and how likely is it going to cause a problem to anybody else? Okay, that's our risk assessment. IP and control, or IPC, infection prevention and control, provision of personal protective equipment, hand hygiene, promotion of a safe working environment, or I'll read it there, promotion of safe work spacing, provision of clean environment, waste management, and education. Okay, so risk assessment, prevention and control. How are we going to prevent and control infection? Disinfect, sterilize, yes, dirty and clean equipment kept separately, things that we do normally as a nail technician, beauty therapist. This shouldn't be strange to us. We do this all the time. Hand hygiene. We used to wash our hands before the treatment, during the treatment, and after the treatment. Nothing new to us. Yes? As a profession, we are a very safe profession, because you can see all these things are things that we normally do. Right, promotion of safe work spacing. So that's our space when we work around us. Now, usually in some salons, nail bars, we sit right next to each other, don't we, usually? And we work and we talk to each other. We talk to our clients because we're social people, okay? That's just us, we're socials. We need to be aware of our spacing. So if you're in your, most of the time in the beauty therapy salon, you're very lucky, you tend to have a room, don't you? So you work by yourselves, which is very good. In the nail bars, you may then be sitting in a row. So you need to be aware of your spacing, not just for yourself, but for your client. So therefore you may have the workstation next to you not being worked. So you would be working a space and you would be working, or I would go and work on the other side of the room. Yes, so that we have spacing. Okay. Provision of clean environment. So that's a little question that I want you to think about for a second. Provision of clean environment. Now, I mentioned it very early to you. What do they mean by provision of clean environment? So unusually, I'm going to ask you to unmute. Yeah, so unmute your devices, and I want you to tell me, what do they mean by provision of clean environment? How can I make my environment clean?
By keeping the area clean, hygiene.
Okay, lovely.
By keeping the sanitizers in place, so every client comes, sanitize after each client, sanitize the area.
Excellent. Well
Sanitize
done.
our hands as well.
Yeah, and also clean the chair.
Brilliant.
If you're doing a treatment.
Good.
Yeah.
Well done.
Yeah.
Excellent. As well as your working area.
Yeah.
Should be clean and tidy.
Another one that we tend to do, and we tend to forget, ventilation.
Yeah.
Ventilation.
Yeah.
We're working so hard, we're making money and we're working and we're giving our all to our client. We tend to forget ventilation. Please make sure you have good ventilation, an open window. Yes, if you can. Some salons and some nail bars will not have that open air facility, but keeping your staff in mind now, let's split our staff different from our clients. Our clients are actually coming in from outside, okay? You may be sitting there, ladies, for a good 4 or 5 hours, yes? Then you might have a break, and then where do you go? At the back, into the staff room to eat. Remember, go outside and get some fresh air.
Okay.
Very important, ventilation, especially in this time, because you are breathing. And some salons, they have air conditioning where the air just goes round and round and round. That's like our chain of infection, isn't it? Yes, it's not been broken. You can break it by stepping out and getting some fresh air. In our nail bars, we have and I've forgotten the name of it, and it actually draws stale air into. Have we got any nail ladies here or gentlemen? What's that little machine that takes all the dust in the air? Oh, nobody. Okay. It's escaped me, but it cleans the air basically. Yes, it takes all the dust, you know, because when we're filing away or we're using the drill, little micro dust particles are in the air. Yes, and it's an extractor. Thank you, whoever said that. So an extractor is very good. Yes, because it doesn't just push the air round and round and round. It actually takes things out of the air and extracts the air, so you have clean air. But please remember, do go outside. Thank you so much, ladies. That was very good. Waste management. We spoke about waste management. Please make sure that our bins have a liner. They must have a top on top of the bin. It must be a pedal bin, so we're not touching, opening, touching, opening, touching. Yes, so it's a pedal bin. We use our feet, but they must have a liner inside that bin, and then we can tie up the liner. And then if it is not contaminated waste, then it can go with the general rubbish. If it is contaminated with body fluids or blood, etc., then it has to be put separately and it will be collected depending on what your borough says. Yes, so we tend to have sacks or bins or bags, and they tend to have colors. Usually they're yellow, but depending in what part of the country you are or what borough you're in, they might be green, they might be blue. You might have to put all that contaminated waste into those sacks or bins, and then the council will come, you arrange with the council, and they will come and take it away and actually incinerate it. It's the same thing with your sharps. You need to arrange depending on what the arrangement is with the council, and they will come and take away your sharps and dispose of it. If you're working in nail bars, ladies, sometimes, or gentlemen, sometimes, you know, there's blood products on tissues, or that would go in contaminated waste as well. Okay, sometimes, you know, we catch the cuticle and we need to stop it from bleeding. We sort of press down on it, but there's still blood products there, so it doesn't go in the normal waste. Okay, well done. Excellent. I think that has taken us down to the end. Oh no, there's one. Okay, so the role of the risk assessment. Okay, the phone. Okay, the role of the risk assessment in preventing COVID. A risk assessment is a careful examination of what in the workplace could cause harm to people, so they can assess whether you have taken enough precautions or should do more to prevent this harm. Yes, so remember, the phone is the hazard. How likely is this going to cause harm to my clients, to me, or my staff? Okay. It is a legal requirement to assess the risks in the workplace so that plans can be put into place to control and minimize those risks. The law does not require all risks to be eliminated, but that people are protected as far as reasonably practical. Okay, so what it's saying, if that was a hazard, I could sometimes quite easily just put that phone down, and that's removed that hazard. Yes, but sometimes I don't have to legally write up something to say that we're not allowed to have mobile phones within the salon. I could then personally look at just saying, well, that's going to be a distraction, so that needs to go in that basket, and I've eliminated or taken away that risk, but it is a legal requirement that you do carry out these risk assessments. Okay. Processes involved in a risk assessment is to identify the hazard, decide who might be harmed and how. So me and you, and how would we be harmed? On my phone, nothing really, but let's go into technical, maybe it's radiation. Let's say radiation comes through it. So who's going to be harmed and how they're going to be harmed? And then evaluate the risks and decide on what precautions I'm going to take. So the radiation that's coming from my phone is so little that if I have it within the nail bar next to me on the counter, is it really going to damage me and my nail technician? Maybe I can just ask my client to put it away in her handbag. Okay, that's been eliminated. Okay. Then record the findings and implementation. So record that from now on, we are going to decide that if our clients have phones, that we want to put them in their handbag. This is all example, ladies. This is not what we want to do. This is just an example. Yep, we record, we decided. Then we review the assessment and update it if necessary. If 2 months down the line, I said, no, I need my phone because I need to check my children at school. It's me as the client. I need to have it here. I'll put it at a distance from you. So maybe I need to review it after a little while. Yes, I don't have to ask, because when the phone now rings and I've nicely painted that lovely client's nails, what is she going to do? Go in her handbag and ruin my paint job to get her phone out. Yeah, so it may not be practical. Risk assessment notification and signage could be signage publication on the website. So risk assessment notification, you need to notify and you can sign. You have a risk assessment. You know, when you go into the toilets, let's say at Westfield, yes, they usually have a little risk assessment paperwork. If you have time, you're probably not looking at it, but they actually do have it up there to say that it's been risk assessed and what they plan to do. Okay, brilliant. So I hope that's a bit clear about the risk assessment. So what is the role of it? The risk assessment is for staff, clients, workplace, treatments and services. So these are the things that you're risk assessing: your staff, your clients, the workplace, and your treatment services. Method of minimizing the risk in a beauty salon nail bar and the implications for insurance. If you do not carry out, remember I told you it was a legal requirement. If you do not carry out and do not have recorded your risk assessment, your insurance can be invalidated. So if something happens, they won't pay out on it. Okay, so it's something to bear in mind. Okay, whoops, I'm going the wrong way. Social distancing. Individuals maintaining distance while interacting. Social distance is enforced to limit or prevent spread. It's important to follow social distance guidelines, whatever country we're in. We've established earlier, I think it's 2 feet now. Social distancing will affect the workplace layout, for example, communal staff and client areas, the number of staff and clients or visitors that are actually in that salon or nail bar, as suppliers are able to visit the premises at any time, and the management of staff, clients, and visitors. Yes, so when we're thinking about our social distance, we need to take, oops, sorry, ladies, gone ahead. We need to take all this into consideration. Respiratory hygiene, I spoke to you about this before, yes? So I'm not going to spend too long. There is an etiquette of how to cough, okay, and this is it. It's important to maintain the correct respiratory hygiene and cough etiquette to prevent spread. So not just our gentlemen just sneezing into the atmosphere, yes? We need to, we know we're going to sneeze, we either sneeze into our arm, or it's even better if we have a mask on. Yes, mask is the best way, especially inside. Right, and this, why do we have it? It's to reduce the spread of microorganisms, and it then tells you how to, I'm not going to go through that because you can read that, but it tells you exactly how to sneeze and how to cough correctly. Okay, so you could have that up, signage. And this is quite an old one, I remember this, catch it, in it, and kill it. Yes, this was come out before and they've recycled it. And that is the hygiene, the respiratory hygiene cough etiquette. And these were all over the National Health. That's when you used to go into the hospitals. I think they're still up. You used to see that. Yes, if you go in, well, hardly, not, hopefully, not lots of us have been to the hospital recently. I think they asked about doctor surgeries, they were there. Yes, so catch the germs, put it in the bin, and kill it by washing our hands. Okay, brilliant. And that quite timely takes us to the end of our presentation. Look at that, 2 o'clock, ladies, on the dot. Okay, so I just want to give you a homework. So have you got your pens? So you can write your homework for this week. Now we're looking at learning outcome 2, which in your workbooks is page number 8 to 10. 8 to 10. Questions 14 to 19. So learning outcome 2, page 8 to 10, question 14 to 19. Learning outcome 3, which is page 11 to 14, question 20 to 27. Okay, ladies and gentlemen, enjoy the rest of your afternoon. It was lovely to see you again. Sabrina, I don't know if there's anything you would like to say.
No, Sabrina's not saying anything.
Oh, she's not. Yvonne. Hello, Yvonne. Welcome. Welcome.
Okay, thank you everybody for your attendance, and to say to you, we've had some fantastic results. People have done their IP, infection prevention, online, and we've got some really, really nice high results. We've even got one student who got 100%. So please try and get your workbooks in and book for your IP, because there are only a few spaces left. So hope to receive your information soon. Thank you very much, Debbie, and thank you everyone for your attendance.
Thank you.
Good day now. Bye.
Thank you.
Bye.
Bye. Thank you.
Bye.